Well, hello again, everybody. Welcome back into the Keep Boone Healthy Community Information Channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. It is wonderful once again to be teamed with our group of medical and community experts as we talk about a new vaccine milestone that is coming to the high country, and that has been that very much anticipated shift downward in the age spectrum to now include people in the 12 to 15-year-old age bracket as being eligible for Pfizer vaccine. We're going to talk about that, some of the where you can get it, what's gone into the study, and ultimately give you as much information as we can about this particular milestone and then how that works into the overall vaccine message and what we've got going on here in Watauga County. So let me introduce the panel real quick. Once again, Jennifer Greene, Director of Public Health for AppHealthCare, longtime listener, first-time caller, not really at all. Dr. Scott Elliott, same thing, Superintendent of Watauga County Schools. Sean Burroughs is the Director of Pharmacy for Appalachian Regional Healthcare System, and Dr. Scott St. Clair comes to us from Blue Ridge Pediatrics and Adolescent Medicine. All of these folks have been tapped numerous times on this channel for expertise and some valuable advice as we have moved through this long process, nearly at the 5.5-month mark now, since we really started seeing vaccine be deployed here in Watauga County. So first things first, Jennifer Greene, kind of give us the update on where things are vaccine-wise here and how this new milestone plays into our ultimate vaccine story in Watauga County.
Well, I'm very excited to tell you we're continuing to see people get vaccinated. Things look a little different than they did when we first started in December, but we're at 43% of our population with at least one dose, which is really good news. And we need to keep moving forward. And I think, have a higher goal for ourselves. We know we want to leave this COVID pandemic behind, and that's the best way to do it. What's most exciting to me is seeing that we have younger age children now being able to get this vaccine with Pfizer announcing this data and the FDA giving approval. We know that 12 to 15-year-olds are a critical age. We have, at least for myself, I have a son who's very active and athletic, and it's going to help him get more back to normal and also keep him in school. And that's what I'm really excited about as a parent. I think the other thing for folks to hang on to is just, I am color coordinated today, David. You'll notice my beautiful personality on my mask, but I know people are tired of the indoor mask requirements. The best way for us to move beyond that is to get people vaccinated. So, I just want to encourage folks, this is the time. We're ready to help you get your shot wherever you want to get it. I feel like that's really what we're trying to move towards, is make it easy for people to get vaccine.
I really resonate with what you said as a parent there a second ago, Jen. I've got an age-appropriate daughter that's ready to jump in the car right now to get this done so she can be with her friends this summer. That was all it's about, socialization. So I definitely understand that. Sean Burroughs, I'm going to ask you two questions. One, to follow up on something that Jen just said. We have been talking about vaccines since late December, early January, and I think sometimes we lose sight of what the goal of vaccines was. It wasn't necessarily to completely eradicate COVID overnight. It was to lessen the percentage chances that people would develop major issues, and we're looking at hospitalization and some rather heroic measures during those hospitalizations. What can you tell us about what you're seeing in the county right now at the hospital level in terms of vaccinated, and non-vaccinated populations, and what that hospitalization picture looks like now, if that was the goal, to try to avoid as much as possible?
Yeah, sure. As back in January and February, it was hard to keep track of anything because we were so inundated with folks in the hospital with COVID. As things have winded down, as the vaccine has been out, administered, and obviously been effective, we're seeing significantly less people in the hospital. Very few people in our short stay unit, which is our COVID ICU unit. And those folks that are still trickling into that unit are unvaccinated. We have not in quite some time seen, if ever, I don't want to speak without knowing it for sure, but we haven't seen in some time a vaccinated person in our short stay unit, in our critical care unit. So again, just like you said, obviously the vaccine is effective, and it was touted as 95% effective at giving immunity to folks. But it's really, from what we've seen, even more effective than 95% at keeping people out of our critical care unit. So as you said, 95% immunity is great. That's still 1 in 20 that may come down with COVID. But even those 1 in 20, the vaccine seems to be preventing them from getting admitted seriously into the hospital. So just a good, it obviously is working. And I encourage anybody that is might not be on the middle of the fence, might just be looking over the fence, to really consider, if you haven't been vaccinated yet, getting vaccinated, because it does work.
So, Sean, leading into that, there is now a new constituency that is available for this, and obviously a lot of parents that would like to know, as the FDA approved 12 to 15-year-olds being eligible for Pfizer vaccine. Now, what went into that study from the pharmaceutical end of it, from your pharmacy lens that you normally look at? What are some of the things that you saw in the data and the research that came to you that suggested it was time to get this thing approved, and then what went into that ultimate trial process?
Yeah, and again, this isn't, I don't want people to think that they just started studying this last month and it looks good and they're going to go ahead and approve it. That's not the way it works. They've been studying this for a while. They followed up for a couple months with the folks that were in the initial clinical trial, and of the 2,200, 2,500 folks that were in the trial, half of them received the vaccine, half of them received placebo. I believe it was 18 in the placebo group came down with COVID, and 0 in the vaccine group came down with COVID. So it's as effective, if not more so, in that population than it has been in the adults. They've been able to generate the immune response from the vaccine. So again, this wasn't a fly-by-night, let's get this approved. They're doing similar studies with age groups down as low as 6 months. So just like the flu vaccine, they're going to follow those patients for 6 months after they get their doses. And so maybe by the end of this year, we'll have vaccine even lower down for the age of 6 months and above. So it wasn't quick, it wasn't shoddy, it was done with good scientific literature and technique, and it's shown that it's effective in that group, which is going to help decrease the transmission of the virus. So again, good things.
And one last question for you. What does the side effect profile look like within this age group?
Very similar side effects, such as, injection site reaction, injection site soreness, some lethargy, so they're tired, maybe some fever chills, similar to what you've heard with adults, and it lasts for 1 to 3 days, nothing more severe. And if anything, it seems to be the younger population at that age, 12 to 15, seems to be recovering quicker, just like with most things, than us older folks are able to.
So, Dr. Scott St. Clair, we'll ask you, you see patients of all ages, but in the adolescent patients that you see, the advice that you're giving to families about why healthy adolescents should consider strongly getting this vaccine. What is that message like coming from you and your practice right now?
Yeah, so we're super excited about this new phase and anticipating everything the CDC agrees with the FDA that this will be approved. And that's a question I'm hearing a lot, and I sort of answer it in several ways. I think first off, it's just important to know that this will definitely protect that teenager, that will protect their health. And so while those teenagers have not been at high risk to have complications, there have been a certain number that have died. There have been a certain number that have had complications and ended up in the hospital. There's been a certain number that have ended up with this long COVID, more chronic symptoms. And so just because it hasn't happened as frequently doesn't mean it doesn't happen. And so if you get the vaccine as a teenager, it is going to keep you from having any of those bad outcomes from happening. So that's a huge win. Secondly, it's going to end up protecting everybody around you. So if you're a teenager and you get the vaccine, it's going to protect your family members, your parents, your grandparents, aunts and uncles, but it's also protecting those people you're in class in school with. It's those kids that are on your sports teams, that it's at your church Sunday school. It's every ripple effect of every interaction you have in all aspects of your life. You end up protecting all of those people. So I think that's another really important point. After a year of quarantines, this is the one that gets most people's ears perked up. But if you get your vaccine and you're fully vaccinated 2 weeks after your vaccine, you're not going to have to quarantine anymore just because you're around somebody that had COVID. So I just think that's so important for people to know. Your quarantining goes away as long as you're feeling well. If you've got the vaccine, you're fully vaccinated. So if you do not want to deal with any more quarantines through COVID, get vaccinated. And I think the other big one is just emphasizing what Jen already said, which is the ability to return to life as normal is within our grasp, but it's going to take people getting vaccinated. And so if you're a teenager and you'd like to be doing stuff that you normally would be doing, hanging out with friends unmasked, having sleepovers, all the things that you remember pre-COVID, those things are all within our grasp, but people have to go get vaccinated for all those things to happen. So I think the teens have a great chance to be a part of life returning to normal. Sometimes kids do a great job of leading adults back to doing things that are normal. And so I'm hoping the kids can get vaccinated, but also be great champions and advocates in their friend group and family group to help move us back to a normal state.
With that said, Dr. Sinclair, I know that you and your team at Blue Ridge Pediatrics and Adolescent Medicine, working with some other partners in the community, Boone Drug being one of those, and they've been a part of these conversations many times with us here in this setting. What can you tell us about the where and when will this become available, and how can families begin to access this vaccine when it does?
Yeah, so we've been preparing for this day, but waiting until we got formal approval. And it sounds like on Wednesday afternoon, depending on when you're listening to this, by Wednesday afternoon, the CDC should have approved this. And if the CDC does approve that, Boone Drug is going to be doing a clinic at our office at Blue Ridge Peds on Friday from 3 to 7. And they're going to do another one next Wednesday in our parking lot, 1 to 5 next Wednesday. So we will send an email out to our practice later today, hopefully. And we'll also, hopefully, with the help of the school and health department, get that information out there. But those are going to be two pretty immediate ways for people to get vaccinated that are interested in getting vaccinated.
The other Dr. Scott joins us now, Dr. Scott Elliott, Superintendent of Watauga County Schools. Dr. Elliott, you had a plan that you all implemented at the school system level a few weeks back, where you began to vaccinate high school students and their families, and gave an opportunity for the student to bring the family along with them. Do you envision a similar opportunity with this now, going into a lower age group and still being able to use the schools as a hub for some of that activity?
Yes, we absolutely do. I appreciate hearing from Dr. St. Clair the plans that are already in place with our local healthcare providers to do this. We've been working closely with Jen and her team and Sean at the hospital. Everyone's really come together to provide these opportunities. Actually, today, as we're recording this over at Watauga High School, we have a shot clinic that's going on for a second dose clinic for those who received their first one a month ago. Next week, we'll be doing the same for a second one. We, again, as Scott said earlier, pending what we anticipate is the approval from the CDC and FDA. All of this process is being completed today. We're going ahead and planning. We know that our partner with Boone Drug, they have been consistently receiving the Pfizer vaccine. So working with the health department and Boone Drug, we have planned for 4 additional school-based clinics that we plan to offer. We'll be sending these dates out to our parents, and be glad to get it to you in the chamber to share out. But on the 18th, next Tuesday after school, we will offer a clinic at Valley Crucis School. The next day, on Wednesday, we'll have another clinic in place at Watauga High School. Then later that week, we will have a clinic at Cove Creek School after school, and the following week, we will do one at Parkway, kind of have them in the different corners of the county. And not just for the students. So I want to reiterate something that I think that Sean said earlier, which is that we have seen cases of COVID with our school-age children. And as of today, I think we've had 112 confirmed cases among the students who were enrolled with us in school. Not nearly the number that we have seen, 250, about 112 with adults, about 250 school-age students enrolled with us. So it is happening, and it's continuing to happen. We had a COVID positive case just this week. But what we are seeing as we have more students who are vaccinated, and as well over 90% of our staff are vaccinated, is that the number of screenings, the number of symptomatic folks coming into school, and the severity of illnesses have just declined significantly. Now, what has gone up as we brought more students back to school is close contacts among those who are not vaccinated having to be quarantined. So just as several folks have said here, we all want normalcy, and just because we're tired of it doesn't mean we can just, stop with the masks and all of the things that have gotten us to this place. The vaccines are the way to do that. And I would invite, when we have these clinics, for parents to come with their children, and if the parents haven't been vaccinated, for the parents to receive the vaccine as well. We're seeing very little, minimal actually, of those 250 cases, probably fewer than 10, maybe less than that, cases of students to student secondary transmission. Recently, they've all been transmission from an adult, usually a parent, to a child.
And you bring up an interesting point of what you have seen in the schools now, and while we're about 2 weeks out from the end of this school year, and we'll have a longer break period than normal too, with the creativity with the snow day schedule that we all appreciate. We also see the opportunity to start thinking forward, and many parents are already starting to think about what operations look like for schools, what that cadence to building back up to getting back in August is going to look like. What do you anticipate at this point in time here in March, or in May rather, about what we could see in August from an operations standpoint?
Well, we've heard from DHHS and the governor's office that the mask mandate and the loosening of some of the other social distancing requirements are conditional on vaccination rates. And so the more people who are vaccinated, the more flexibility and freedom that we have. We look forward to a time when we have students back in school with no masks on, for example. But right now, it looks like we will still have a mask mandate in place from the state at the start of the school year, unless something changes. Now, maybe if we see high vaccination rates among the 12 to 15-year-olds, we continue to see low prevalence of secondary transmission or illness among the younger children. Maybe we'll see those mask mandates lifted and we can start school without masks and without as much of the strict social distancing and contact tracing procedures that we've had in place. But again, the virus isn't just going to evaporate and go away over summer. The heat's not going to kill it, and it certainly wouldn't here anyway. It's viral. It's going to depend on how much we are able to prevent it from being spread from person to person. And the vaccine is a way to do that. I appreciate everything that Sean said about the veracity and the thoroughness of these clinical trials. And I can understand parents' concerns about children as young as 12 years old getting something that some people might perceive as being fairly experimental. Now, I'm not the health care expert in this group, but messenger RNA technology is decades old. This was not something that just got cooked up in a lab overnight. And as you and Jen mentioned earlier, and I'm looking across the screen, I think all 5 of us have our own children who fit into this age group. And as is true with all things about school or children, I would never recommend something for others that I wouldn't do for my own children. So my 12-year-old and my 15-year-old will be at one of those first vaccination clinics, and they'll be getting the vaccine. We are prepared for side effects, which we do not anticipate, including things like more eye rolling or bedrooms not being cleaned or homework being turned in, things like that, that are prevalent in this age group. But I just strongly encourage parents to consider doing for their children what we always do. We always take them to the doctor to get their vaccines and their booster shots and to protect them. And as Dr. St. Clair said, our kids have missed out on so much. Proms, even our modified graduation will be different. Athletic events and different things that they've missed out on. We want them to get back to normal as soon as possible. The vaccine is the way to do it.
Wonderful points made by all of you on this topic. One thing I want to follow back up on, though, and Sean and Jim, we'll tee this one up for you. Dr. Elliott mentioned, as the school system's already done, that this is an opportunity not only to get students but their parents in. That certainly has some workforce applications to it, as well as businesses are not only battling the need and availability of talent to be able to hire, but then also making sure that those folks are as healthy as possible when they do come into the workforce. Sean, we were talking before we started today about some things that the hospital system is doing to maybe extend hours or give alternate times for people that may work during the day and aren't simply available to break away for an hour or a few minutes to even go get one of these vaccines. What can you tell us about hours of clinic opportunities that you all have running right now?
Yeah, David, as the mass vaccination clinics wind down, we are offering evening and weekend clinics at App Family. So Wednesday evenings, usually from 3:30 to 6 or 6:30, and then Saturday, typically from 9 to 11, somewhere in there. We have appointments available in Boone, and then out at Cannon Hospital at the Baker Center, we have Saturday morning appointments out there as well. So hopefully this will help those that have been unable to get to these daytime clinics still come in and be able to get vaccinated. And I will add that some of the discussion that I've heard from people that aren't vaccinated yet are they're not sure about the safety of the vaccine. They're worried about the long-term effects. And I would just encourage everybody to do as much research on that as possible, because it's very apparent that the long-term effects of getting the virus itself are much worse than theoretical long-term effects of the vaccine. You know, there's neurological symptoms. There's a lot of things that have been attributed to the virus of getting coronavirus that aren't attributed to getting the vaccine. So the danger of not getting it is significant.
And Jen, to kind of follow up on the importance factor, but also I think even for those that are vaccinated, we continue to hear the messaging to not let your guard down at this point in time either, and that being important. Anything that you'd like to share on that perspective, as well as things that AppHealthCare is doing as well to maybe change the scope of what you're looking at from a vaccine deployment standpoint at this time?
Yeah, well, I think the biggest piece of this is that all of our community can have a role to play in our success. We want to move beyond having COVID ruling our lives. We may always have to face COVID in our community, but hopefully not at the scale that we've lived this past year. So be a messenger. If you've already gotten your vaccine, hopefully you can help someone else that you love understand why you got a vaccine and link them to some other resources. I think that's important. The other piece that I would just say is our goal is to try to make vaccines really easy and accessible. So, you know, though there are lots of opportunities to make appointments, we're going to try to have a mobile vaccine effort where, you know, if you want to host us to come and give vaccine at your place, we have an interest form replacing our prior interest form. You can actually go to our website at apphealthcare.com, tell us that you want us to come and host a vaccine clinic, and we'll send our team out and host a vaccine clinic. There's no charge for folks to get a vaccine. So it's there because we want to try to make it super easy for people. We know life is busy, and sometimes people might put off things like getting a vaccine. So having evening clinics like what Sean's team is doing, and what we're seeing at Blue Ridge Pediatric and Adolescent Medicine, the school clinics, we're trying to make it so that you see lots of opportunities to get a vaccine, and it's easy. So I think that's really what I want to say is help be part of the solution, help us get to the other side of this.
It certainly is amazing to think about where this conversation has gone in the last 5 months. I can remember a time where we were talking about, with the number of vaccines and the way that the groupings were working at the state level, that we thought this was going to be months and months, and looking even into 2022 at one point in time, and now with the vaccine availability and the creativity of folks in this group and many others that are out in the community making these vaccination efforts happen, we certainly do have the opportunity to get to a full vaccination state a lot easier. And I will say this last thing before we close down. I know a lot of businesses that are again looking to hire, wanting to keep disruption to a minimum. I think as many of our experts said too, with just the simple rules being different around quarantining, if you are vaccinated versus non-vaccinated, if you're looking for ways to minimize disruption, this is certainly an easy way to do one. So we continue to encourage you to be transparent with your employees, with your family members, with anybody that's considering vaccine. All of these experts have great information on their websites. We'll continue to share those links so you can provide those that are considering this with the latest and most detailed information about side effects, some of the long-term, short-term benefits, and those types of things. So as always, we thank this group for getting together again to push out some information on what is another big milestone in the vaccine storyline. Jen, we look forward to the day that the only conversations we have are about AppHealthCare doing seminars for interest form creation. Because you guys
Yes.
certainly have done many of them, and I think you're an expert in that way. But we look forward to talking to you all again soon.
Thank you, David.
Thanks, David.